everyone, welcome back to our channel. Today's video will consist of you guys coming along in a day in the life of a home health nurse. I have one patient today. It is a wound care, and you guys will be seeing the full treatment, everything, so I'm super excited about that. I've been a home health nurse for 3 years now. I recently just got a new job about 2 months ago. I'm going to be getting into that in another video. But I still do home health on the side. I love home health. I probably won't ever stop working. The money's super easy and the schedule is very flexible since I still am in school doing my bachelor's. I have another full-time job and now I'm doing YouTube. So I'm super excited for today's adventure and stay tuned. Hey everyone, so I'm currently on the way to my patient's house. She's a 67-year-old female who has 2 wounds on her right lower extremity, one on her calf and one on her ankle. I did the start of care for her about 3 months ago. Now we're going on 4 months. She's been a daily wound care. Primarily the LVN has been going out to do the daily wound care. The RN will go every couple weeks to make sure everything's going smoothly, the plan of care is going as it should, monitor for infection, and also report back to the doctor if I need to. So today you guys will be seeing the full treatment, the full wound order. The only thing is, obviously for HIPAA reasons, I will not be showing the patient's face, where they live, their address, or giving you their name. We're just gonna be looking at the wound today. So I'm super excited and can't wait to show you guys. So we just got to my patient's house. I'm getting ready to go in. I'm checking that my nursing bag has all the equipment that I need for the wound care that we're doing. I have my PPE. And then one little trick that I love, this is like a little step stool. But when the wounds are on the lower extremities, this serves as like a little seat, because if you're like this all the time, oh my God, your knees and your thighs are shot. So I think I bought this at like Big Lots for like $5.99, and I use it as my little seat when I do wound care. So that comes in really handy. So my bag is set. I have my new N95 that we're wearing due to, you know, the pandemic. Be safe. I'm not only keeping myself safe, but I'm also keeping my patient safe. And then also face shield, just extra precautions. I'm tested every 2 weeks with my job to make sure that I'm negative, and also my patient is not going anywhere. She's older, she's not exposed. Just precautions. We have my nursing bag, and then my step stool, and we're good to go. So we have our 4x4 gauzes. We have an ABD pad, which stands for an abdominal pad. We have some Curlix. We have Coban. We have our 2 applicator cotton sticks. Paper tape. We have some collagen dressing. We have Adaptic. And then we have our ointment and we have our cream. The ointment is Santal, and we have our cream, which is gentamicin. Gentamicin is like an antibiotic to prevent infection. The Santal has collagen and a bunch of other stuff in it to promote growth of the skin. We have the portable blood pressure cuff. This works really great. I bought off Amazon 3 years ago. We have our pulse ox for the heart rate and the oxygen saturation. Then we have our thermometer to check our temperature. And then also I have these wound care scissors. I also got these off Amazon. They're super helpful when they're bigger. And it has these ridges right here, so when you're cutting dressings off, you won't stab or injure the patient. We have these little mats, so when we do the wound care, we don't ruin the patient's furniture or anything, and it catches all the drainage. We'll be taking her dressing off. This is a little tough because this is what, a 3-layer wrap. We have our little handy dandy trash bag on the side for all the wound care. This is the adaptic. This is so when the leg and the wound is draining, the ABD pad that we just took off doesn't stick to her skin and doesn't stick to the wound, and so when we tear it off, it's not tearing the new skin and trying to grow. So we have a small wound right here on her right outer part of her ankle. Kind of a newer wound. She has a lot of edema, so she kind of gets blisters here and there. And then right here on her right inner part of her leg, kind of by her calf, is our major wound that we have been treating for the past 3 months. There's no sign of infection. It looks clean, it looks good. Good color, the granulation's really good. Just a little bit of drainage, everything looks good. Check the foot for a pulse, make sure, good pulse. And then we'll start the treatment. So we have a wound wash. I have to be careful with this because you spray it and it's like a hard stream and then it gets everywhere. So you have to do it pretty light or else you're for sure going to get splashed. So this light wash. This is why it's very important to have a mat under to absorb and catch everything. And we're just cleaning it and drying it. On areas that there's not a wound, I kind of press lightly and come down, but when area there is a wound, you don't rub, you just pat. And try to use a new gauze per every wound because you don't want, if there's different bacteria or one has more bacteria than the other, you don't want to transfer it. So we will be mixing the two creams. We have the Santal, we have the gentamicin. We put it on a clean kind of 4x4, just a little bit. And then we have the gentamicin. Okay. Then we have our cotton tipped applicators. We'll go ahead and mix the ointment and the cream. And just as we use a different gauze, we're gonna use a different cotton tip applicator for each wound. Good, so we're thoroughly mixed. Get the whole wound bed, get the sides of the wound bed as well. Make sure you rub it in there good. Get enough cream on there. Nice and gentle because these wounds do hurt the patient. Now for the first layer we're gonna apply, it's gonna be the collagen. It's really thin paper, so you can like pretty much tear it or cut it. I'm just gonna go ahead and cut it. You cut it to the size of the wound. With this, we'll apply right over. It should stick, shouldn't fall off because we already have the cream. Another one. Put it right on over. And then we're gonna do one more. Right on over. So we have our Adaptic, which is a non-adherent dressing, and then we have our ABD pads. Same thing, we're gonna cut the Adaptic, and we're gonna fit it to the wound, because the collagen will kind of disintegrate into the skin to promote healing of the wound bed. So that's why we're still putting the Adaptic. Lay it over perfectly. And then we have our ABD pads. The abdominal pads kind of just capture all the drainage that leaks from the wound. So we'll place one right here. All right, this is the tricky part, trying to hold everything together to do a good wrapping. You anchor it. Make sure it's nice and snug, but not too snug where you're cutting off circulation. I go up to about right there and then I'll make my way back down. Thin piece of paper tape, because we are gonna put a secondary dressing on, which is the Coban. Paper tape is cool, you put it on and it just rips off. Just like that. And then we have Coban or Coban, whatever, tomato. Start at the base of the foot. You work your way up. Once again, not too tight because you don't want to cut the patient's circulation. And then they're calling you 2 hours later, telling you to come back to redo the dressing. And you don't need tape to secure the Coban because it just really, it forms to itself. You just want to press it in. Okay. Hey everybody, so that was my wound care and my patient for the day. I'm so glad I got to show you an in-depth of what I do in the wound care and the treatment. Home health nurses do so much more than wound care though. We have acute patients with trachs, G-tubes, PICC lines, we start peripheral lines, we collect blood, we collect urine, and just so much. So I'm excited for the future and to show you guys little snippets of home health nursing. My next videos will be consisting of what's in my bag and how I organize my trunk and what you really need to be a home health nurse. So I'm so excited. Thank you all for the support. Keep on tuning in. Me and Little Man will be closing out today's video. Say hi, Papas. Thank you guys so much and see you guys later.